Ever woken up in the middle of the night with a sharp shooting abdominal pain? Do you know that 1 in 10 people around the world experience this pain because of kidney stones? Today we are here in conversation with Dr. Nagarjuna Reddy, consultant urologist at NU Hospitals. We are in conversation with him to bust myths, confusion and fears surrounding kidney stones. We've seen different forms of stones, but never seen a kidney stone. Is it a real stone? How was it formed? Can you please take us through that, doctor?
Definitely. So, kidney stones do look like natural stones. So, in fact, the way the kidney stones form, so there are some similarities they share. How the natural stones form in the rock beaches, rivers, or in hot springs. The same way, the same mechanism, little bit different. The kidney stones also do form. So, like the natural stones that are available on the earth. So there are different types of kidney stones available in different shapes, size, and color as well. And in fact, the composition. So most of the stones that are available on the earth, they share the common elements also, like calcium, phosphate. They're also there in the natural stones. They're also there in the kidney stones as well. Most commonly, the kidney stones, we do have 4 types of stones: calcium stones, uric acid stones, struvite stones, and cystine stones. So calcium stones, most of the time they'll form with calcium oxalate, to a lesser extent calcium phosphate. So they look like the small pebbles available on the river, like dark brown pebbles on the river. They look like the same. And these uric acid stones also look like white pebbles that we commonly see on the river. So this is a more similarities are there. So the lesser extent, so calcium oxalate stones amount for around 80% of the stones. And
they're the most common
they're
forms.
the most common form of the stones that we see commonly in the clinical practice. And around 10% of the stones are uric acid stone, and around 10% of the stones are struvite stones. These are also called infective stones, infection stones. So they're more common in the people where there are recurrent urinary tract infections, and they grow little rapidly as well. And very rarely there are genetic forms of stones also, cystine stones. So there is a genetic condition called cystinuria. These are the people where we see the cystine stone. These account for only 1 to 2% of the cases.
So, doctor, how are kidney stones formed?
So there are so many reasons for the kidney stones. The most common is when the minerals, the salts in the urine, when they become super saturated, when they cross beyond the level of saturation, they'll form sediments. They form crystals. So the crystals will grow on to form a stone over a period of time.
Okay. So, doctor, what are the red flags of a kidney stone?
So not all kidney stones will give symptoms. So majority of the time the kidney stones are silent. So if the stones are very small and lying in the kidney, they may not cause symptoms. If the stone grows beyond a certain size, or the small stone, even if it comes down the urinary tubes and obstruct, that is block the urinary tubes, then a patient may get symptoms. The common red flags are severe uncontrollable pain to the sides of your abdomen, that is in the flank region, or vomiting, so blood in urine, less urine output or no urine output, or kidney failure, that is rising serum creatinine and there is no cause is identified. These are the usual red flags. And along with this, pregnancy status, single kidney status, these are red flags.
Okay, these are the red flags.
These are the red flags because you cannot risk a single kidney. And in pregnancy, the chances of kidney stone formation and the chances of obstructive kidney stones, the chances are higher. So these are the list of red flags. Especially when kidney stone is obstructed, that is blocked, and urine is infected, that is patient is having severe fever, chills, pain to the side of the abdomen, it is an urological emergency.
So when you have such emergencies, make it a point to rush to a super specialty hospital for an emergency treatment. Correct, doctor?
Yes.
So one more thing, I've heard from my friends saying that a beer will help flush out kidney stones. Is that correct?
It is totally wrong.
Okay.
So it is not at all a treatment, and no amount of alcohol is good for health. So what helps is the water content in the beer helps. Instead of beer, you can have a 1-2 glasses of water. Instead, the same effect will be there. So in fact, the beer gets you dehydrated after that. So if you don't adequately hydrate after having beer or an alcohol, that may cause stones.
Okay.
Second, long-term indulgence in beer or alcoholic beverages will increase the uric acid levels in the body. The serum uric acid levels will go high. That is also a risk factor for stone. So no way the beer or any form of alcohol is going to help in kidney stones. Alcohol is not going to dissolve the stones. The only thing that helps in beer or any alcoholic beverage is the water content. So you can directly take water. Water is the best remedy.
So this is for all of you out there who think beer is a sure shot remedy to flush out stones. It is not. No amount of alcohol is safe. This is something that you've heard from the doctor himself. So doctor, what are the treatment options for kidney stones?
So the treatment options, there are several treatment options. So it depends on the size of the stone, the symptoms of the patient, the comorbid conditions of the patient, and whether the patient is having a urinary infection or acute kidney injury. So commonly, majority of the stones can be managed without surgery. So stones up to 10 millimeter in size, they may pass out spontaneously, especially the stones less than 5 millimeter, or they may pass out with the help of medicines. That we call it as a medical expulsive therapy. We'll give alpha blocker to the patient. The medicine, what exactly it does is it relaxes the urinary tubes, so the stones drops down easily. So 70% or 60+% of the cases can be managed without surgery. So only the minority of the cases will require surgery eventually. Yes.
Okay. So do these surgeries leave a scar?
Thanks to the recent developments in endourology, so over the time the advances in endourology has been immense. So nowadays the scar is hardly any matter for stone surgery. How big is the stone? Majority of the stones, even though if they require surgery, they can be dealt with endoscopic surgery.
Okay.
That is totally scarless. So through the natural orifices, we'll pass our endoscopes and we'll reach the stone wherever it is, and we'll break the stones with the different kinds of energies and we'll take out the fragments. So there are different types of surgeries which are indicated in stone surgery. Again, those depends on the stone size and the location of the stone, where exactly the stone is located. So the commonly used surgical techniques are URS, RIRS, PCNL, and ESWL. So ESWL is to elaborate extracorporeal shockwave lithotripsy. So there is no cut through the skin, only shock waves. The sound waves will be targeted to the stones to break the stones. So with the recent advancement in other procedure, endourology, the indications for extracorporeal shockwave lithotripsy has come down. The reasons being, it is little a blind procedure. We don't know whether the stone is completely cleared or not. There may be chances that it may require 2 or 3 settings to clear the stones. Eventually, it may require with addition of medical therapy or another form of surgical therapy to completely clear the stones. The other commonly used surgeries are URS. This is called ureterorhinoscopy. Usually, we'll use laser to fragment the stone and we'll pass the endoscope through the natural orifices. Then there is no scar in URS. So usually URS is used for the stones which are blocked in the ureters, that is the urine tubes which carry urine from kidney to the bladder. So the second type of endoscopic surgery is RIRS. To elaborate, RIRS is retrograde intrarenal surgery. Again, in this also the laser energy will be used. When the stones are there in the kidney, we'll use this procedure to clear the stones in the kidney with the laser. So when the stones are bigger, suppose if the stones are more than 2 centimeters, then we usually do PCNL. So PCNL full form is percutaneous nephrolithotomy. So in this scar will come, but the scar is very small. It is around 1 to 1.5 centimeter. So there is a miniatured form of surgery also that is called mini perc or mini PCNL. The scar there is even less than a centimeter. So overall, if you look at the surgical options for the kidney stones, a scar is always not a matter.
Thank you, doctor. Today's was a very immersive, enlightening session. I'm sure our viewers benefited immensely from your enlightening notes. Thank you so much.
Thank you.